The Uganda Demographic Health Survey of 2017 shows that 53% of the children aged 6 months to 5 years suffered some degree of anemia. And most of these are in rural areas. While appearing on the morning show, pediatricians Dr. Miriam Apio of Case Hospital and Dr. Daniel Tumwine of the Children's Clinic in Nalia explained the importance of iron.
In making your brain, so the neurons really need a lot of iron. Many of the cells require iron to develop. So, for example, the white blood cells, what we call the macrophages, some of the antibodies we have, they require iron. And so, if you have that, if you lack iron, your immune system won't become as robust.
Where does most of the iron go? It goes into the red blood cells. And when it goes into the red blood cells, what do these red blood cells do? They actually are the vehicle that transports all our nutrients to all the other parts of our body.
Iron is normally transferred to the unborn baby in the last trimester of the pregnancy. However, health experts say this is always enough to cover the first 6 months after birth.
Breast milk does contain iron, and breast milk will progressively result into more transfer to baby of iron, but by about 9 months, the iron stores of baby may not be adequate to sustain baby. Now, in circumstances where baby has not been breastfed, then right there are your challenges.
And this is what a deficiency will cause to your child.
So too little iron is very bad. It can affect the immune system. It can even affect your child's intelligence, your IQ, your cognition, your growth, your immune system. So children who have less iron tend to fall sick almost all the time.
No wonder many children come to the hospital when they are anemic, and they actually tend to get fatigued. They're tired. They tend to get very weak, they get palpitations because of the role of iron in the red blood cell.
Flip the coin, too much iron, our bacteria generally requires iron to multiply as well. So if you end up having too much iron, you end up doing what? You end up having infections. So when a child is sick, for example, and a child is on iron supplements, you don't want to have that child on iron supplements because it can end up causing more infection, and your illness will become worse, unless specifically your doctor requests for them.
The experts recommend that the baby is given supplementary foods rich in iron after 6 months.
Iron basically is very high in foods like meat, fish, poultry. And the kind of iron that is in these foods is basically called heme iron. Why is it called heme iron? It is very easily absorbed by the gut. On the other hand, foods like vegetables, the green leafy vegetables, spinach, nakati, dodo, they also have some quantities of iron. And the iron that they have basically is called non-heme. It's not as absorbable as the iron that you find in the meat. Now, the other foods like the cereals do have some iron too. The only difference is that despite the iron that these foods have, a lot of times they also have some contents of what we call phytates, or inhibitors of iron absorption. And as a result, you find that sometimes mothers will come to the hospital. They will tell you that, well, I'm giving my child maybe millet porridge because it's red, or I'm giving my child a beetroot because it's red in color, with the belief that when the color is red, then perhaps you're giving something that contains iron, which is relatively not true because the quantities of iron in these foods are actually quite low. Cow milk does contain lactoferrin, but not in sufficient quantities. Not in the same quantities as breast milk. And because of that, you find that the iron in cow milk is not as well absorbed. When you look at formula feeds have been designed in such a way that because of the several studies that they've undergone, a lot of the whey protein has been increased in order to mimic the normal breast milk. And up to about 60%, most formula feeds will have up to about 60% of whey protein and about 40% of casein, because they're trying to mimic human milk and also making sure that some of the key things and side effects that one would get from taking cow milk are not as predisposed when you take infant formula.
However, they say some causes of iron deficiency are due to cultural norms, among other factors like poor nutrition and poverty.
Our staple foods do not have enough iron. We don't believe that children can start eating meat until they are older. There's those myths of meat is for adults. Okay, A child who is even 7, 8 years can actually start taking meat. All you just need to do is smash it up or maybe blend it. So meat is very high in iron, fish, so it's very important. There is need to make sure that we have foods that can be fortified with iron. For example, right now what the Ministry of Agriculture has done is that if you take some of the porridges, if you go to the supermarket, you'll find that they have some iron fortification. So that's a good way to make sure that iron actually gets into the bodies.
Walter Mwesije, NTV.